name is Kendra and Stacy.
And our topic for our autoimmune disease was lichen planus. Lichen planus is an inflammatory condition where the immune system mistakenly attacks cells of the skin or mucous membranes. On skin, it appears as purplish, itchy, flat-topped bumps, but on the mucous membranes, such as the mouth, it forms lacy white patches that appear with sores. Up to 44% of patients with oral lichen planus develop skin lesions. More than 70% of patients with cutaneous lichen planus develop the oral lichen planus.
Some patients report a roughness of the lining of the mouth, sensitivity to hot or spicy foods, oral hygiene products, pain, sore gums, red or white patches on the oral mucosa, and possibly oral ulcerations. Approximately 2/3 of the patients with oral lichen planus report oral discomfort.
There are several different forms of lichen planus, which include the reticular pattern, which is considered the most classic form. It appears as white lacy lines called Wickham striae, which characterizes the lesions. The white lacy pattern may be seen bilaterally or unilaterally, usually evident on the buccal mucosa, tongue, lips, and gingiva. The plaque form is represented by thick plaques of varying sizes that may be smooth and appearing somewhat lighter in color than surrounding tissue. The papular pattern is noted by the small, pinpoint papules appearing as small white dots measuring approximately 0.5 millimeters in size.
So the erosive types of oral lichen planus are the bullous form, the atrophic form, and the ulcerative form. The bullous form consists of vesicles ranging from a few millimeters in diameter to much larger vesicles, usually discovered after vesicles have already erupted, commonly caused by speaking or eating. The atrophic form presents a diffuse reddened patches that may be in combination with other forms of lichen planus, such as the white striations of the reticular form. Often found on the attached gingiva, the patient may complain of irritation or burning sensations. And then the ulcerative form features one or several ulcers that are often seen in the association with any of the other disease forms. This form is quite painful for the patient, and the soreness of the tissue will affect eating and brushing of their teeth.
This disease may be found in children and young adults, but are most commonly diagnosed in individuals over 50 years of age, more commonly found in 20% of women compared to 2 to 4% in men. It may go away on its own, but if it causes pain or significant itching, a prescription drug may be prescribed.
A complete intra and extra oral exam is crucial, as most patients are unaware of their oral condition. An examination by a dermatologist may be required if the dental hygienist notices any changes in their oral mucosa. They may be given mild steroids, and to achieve a systemic effect if desired, a rinse and swallow regimen can be designed by the clinician. Some studies find an association between oral lichen planus and chronic hepatitic disease, such as hepatitis C virus infection, autoimmune chronic active hepatitis, and primary biliary cirrhosis.
Oral lichenoid drug reactions may be triggered by systemic drugs, including NSAIDs, beta blockers, and some ACE inhibitors. In patients with oral lichenoid lesions, be alert for any systemic drug as a cause. Thank you for watching. Stay tuned for some more examples of oral lichen planus as well as cutaneous manifestations.